I started out as a social worker, moved my way up, but I always had a compassion for people who were struggling with their health, struggling with changes in their health, dealing with the family dynamics. And over time, I've just kind of evolved into this position. The impact that we have from an organization on the people around us is immeasurable. Facing a serious illness is not easy. And I feel better, I feel confident that the services that hospice provide out there in the community and help people with just such a difficult situation, feeling comfortable, improving their lives, and being able to dictate how they want to live the rest of their life. I think it's really just an invaluable service and something that I love doing every day. There's a lot of misconception about hospice. Most people don't understand that it's actually a benefit that's paid for by Medicare and most insurances. In fact, it's one of the best benefits that is out there. And the idea that people have about hospice is that they're giving up or this is the end. In reality, it's just the opposite. Hospice is a benefit that helps people live better lives. They're able to overcome some of the issues that they're having as far as symptom management, pain, shortness of breath, nausea, vomiting, those things that are really plague people that are dealing with serious illness. We help them overcome that, get them comfortable, and a lot of our patients actually do other things in life. They're not just home in bed. They're going out to dinner with their family. They're enjoying traveling. That's one thing that most people don't even realize. When someone has a conversation with their doctor, or let's say their family identifies that they've been declining and they want more information about hospice, they contact us. We will send a nurse out to talk about what the services are, but also to evaluate whether or not someone's eligible. Not every person who's dealing with a serious illness is eligible for hospice. The prognosis has to be a certain thing, and a doctor has to certify that the patient is eligible for hospice. Once they do that, then we take over as far as we provide everything. It's a great service in that you get everything delivered right to your home within a matter of hours. So if you need equipment, we can have that delivered. If you need medication, that's delivered. We have nurses, home health aides, social workers, spiritual care, volunteers, music therapists, massage therapists. The list is endless, and it's all covered 100% by their insurance. If they need specialty equipment like concentrators or things like that, we provide all of that. It's all included in the package of hospice. The struggle of caring for someone is overwhelming. When someone is declining with whatever illness it may be, dementia, heart condition, lung disease, any of these things that really take a toll physically, but also emotionally on people. And they're not able to really focus on, as caregivers, they're not able to focus on themselves. They're busy caring for someone else. So it's important to get the professionals involved as early as possible. With hospice, we come in and we supplement a lot of the care that's being provided. And then we take care of the details of managing this illness, talking to the doctors, coordinating with services, making sure that the family has less stress and can take more time to enjoy their time with their family member. All hospice is palliative care, but not all palliative care is hospice. So when you think about a trajectory of a disease, so let's say heart failure or dementia, we know that there's the point of diagnosis, and then as time goes on, there are treatments that may be available, and there are things that can be done to slow the progression of the disease. And during that time, there are also symptoms that occur. And palliative care focuses on the treatment of those symptoms prior to someone being eligible for hospice. At a certain point, the patient is then eligible for the hospice benefit, but it's just a continuation of palliative treatment. When someone elects or utilizes a palliative service and a hospice service, their life expectation actually increases. We're taking a lot of the struggle out of dealing with that illness. We're addressing the day-to-day issues that are coming up, like the shortness of breath, the pain, things like that. And then we're helping them actually to extend their life more comfortably. Call today. Call and ask for an assessment to see where and if you actually qualify for services. Find out a little bit more about what the services are that we provide. And hospice is, again, one of those programs that you have to take advantage of from an early stage. That's the best way to do it because we help prepare for what's going to happen. Most people don't understand the trajectory of the disease. They don't understand what's going to happen next. And we see patients in and out of the hospital a lot. That's hard on the families. That's hard on the patient. Our goal is to help keep someone at home as comfortable as possible throughout. And that may be 6 months, that may be a year. We just don't know, but we're there to help them. And the most important thing is to not delay in getting that care today, because that will make the biggest difference in your life. One of the responses that we get most frequently after someone has been through the program and their family member has passed away is that they wish they had elected the hospice service much earlier. And when you have the service, you get the full team. You get the nurse that comes out on a regular basis. You get medications, you get the home health aides, social work, spiritual care. All of those people have a specific role in helping the family and the patient understand what's happening and what's happening next. So we're always planning for the next stage. We're planning for the next event, and we're ahead of that curve. If you don't have hospice, usually what happens is as things happen and issues arise, you end up going to the doctor, you end up going to the hospital, there's a lot of tests. Most people will say, well, I would rather be at home. I would rather be comfortable in my own home and not being prodded in a hospital, not having to take different medications. And that's what we can do. We'll help with achieving that goal.